I wanted to talk about maternal and child health today because that's one of the things that the Democrats are really looking at in the future. And I have been on the health committee now for 3 years, and so I've been in tune with this issue of maternal and child health and how important it is. And in fact, when I got my master's in public health, one of the things that they always said was that if the mother's healthy, the family is healthy, because the mother is the one who takes herself to the doctor and gets the screening, she takes her kids to get their shots, and so she's the one who is also going to get her husband, if she has a partner, and she's going to get that guy to the doctor also. So what surprised me was that I actually learned a lot more about maternal and child health last November from this little girl. That's my granddaughter. So some of you might know that my granddaughter Selah was born with a birth defect in, I can't crack up at the meaning of this. She was born with a birth defect in November of 2018. Now because my daughter had health insurance and she had prenatal care, she knew ahead of time what the birth was going to be like. She was born at TMC as an at-risk pregnancy, as an at-risk birth. She spent 3 months in the neonatal ICU at TMC. And so there was my daughter, her husband, the California grandmas, and me, and we rotated around, you know, making her feel comfortable while she was at the hospital, the baby that is. And so what I saw when I was at the NICU was a whole lot of young women of color with premature babies at the NICU. And so I got talking to the nurses, I got talking to the moms, because, you know, when you're just sitting there, you know, there's not much to do. You know, you're sitting there rocking the baby and then you're talking, right? And so what I found was, or what my sense was from looking around the NICU, was that the face of premature birth in the state of Arizona was young, brown, and rural. And having a master's in public health and having worked in research for many years, when I got home, I started looking this up because I thought, well, that's what it looks like, but is that true? Or am I just seeing a subset? And even my daughter noticed it. My daughter is in her mid-30s, right? And she says, I'm the outlier in the NICU, right? Because she was older, and she was white, and she had health insurance. And so what we see was more women who are younger, women of color, probably on Medicaid. And so when I started, you know, researching this, I found out that there are too many moms dying in the state of Arizona from preventable causes. There's too many babies who are dying. There's too many babies who are born prematurely. There are many women who are having multiple premature births and they're paid for by Medicaid, which means that's $1 million a baby paid for by the state. So if we just gave those women better care, it would help them and their babies, and it would save the state money. So having all these things, too many birth defects, too many premature babies, too many low birth weight babies, this is all in the data at the state of Arizona. We're not the worst state for some of these things, but we're definitely in the 40s out of 50 states for a lot of these measures of health and wellness for moms and babies. And you'll remember, we are a pro-life state, right? So we should be able to fix this. So I'm going to start with the long view. So these are two pictures taken from my district, right? This flowing wells, the trailers and flowing wells. When I ran for office, I said, I want to work for the single moms who are living in those trailers. This is a mansion in Sabino Canyon, so I don't have a lot of, I have about the same ethnic diversity in my district as the whole state, but I have dramatic economic diversity in my district. So we're going to look at the long view first. So I found a bunch of different types of statistics that measured poverty. The Center for American Progress said that Arizona was at 14.9% poverty. The MAP program that's run by the university and the other universities across the country, they're saying that Arizona was at 17%. I think they must be, you know, measuring it slightly differently. But you can see in, remember I have my laser pointer, you can see in the data here that there's dramatic disparity across the ethnicities and the races. So 35% of the Native Americans are living in poverty and 12% of the whites are living in poverty. And down here, we're looking at a little bit local, 18.3% in Tucson. So Tucson is an outlier statewide regarding poverty. So what we see is that TANF, that's the cash assistance for the poor, is not even keeping up with extreme poverty. The red line is people living in extreme poverty in the state of Arizona. The yellow line is TANF benefits. So it's not even meeting all the needs of the people who are living in extreme poverty. And that's because we have the stingy TANF, right? 4 years ago, the Republicans took it down to 1 year. You can get 5 years from the federal government of TANF, cash assistance for the poor, which is not a lot of money. It's like $92 a month per person. And we still won't give it to them. So the TANF is not enough in the state, and I think that that's one of the things that we should do in the future is to make it, to expand it, right, to 5 years. Because look at this, 6% of the people who are eligible for TANF in the state of Arizona are actually getting it. 6%. You know, and we wonder why there's so many people who are being evicted or so many people who can't pay their rent. It's because we're not even giving them $92 a month per person. We're so freaking stingy in this state. I think this is one of the things that has to change, because a lot of this maternal and child health data can be taken right back to poverty. So we are with bad policy, we are forcing our residents to live in poverty. So this is a reality check about local poverty. So this is from the Census Bureau. So the green line is U.S. poverty. The blue line is the state of Arizona, and this orange line is the city of Tucson. So we still are we are an outlier regarding poverty, and this is something we need to really fix. We need to take a look at this. So the other thing that we should look at in the state and also in the city is the wealth gap, right? And so what I found a lot of information from this book, which is a very good book called Our Kids, written by a Harvard professor, very easy to read, but he talks a lot about poverty, gentrification, education, and how these all play together to change family structure and change what's going on in our United States. So anytime you see one of these little square slides, that's come from this book. This is his data. And so this shows the wealth gap based on whether you have a bachelor's degree or high school or less. And so obvious, when you have a bachelor's degree, you're much more likely to make a higher salary. And then down the bottom, that's your income with a high school or less. So there's a dramatic wealth gap. And in the state of Arizona, the wealth gap is 15 to 1. So that means the top 20% of the earners in the state of Arizona are making more, 15 times more than the lowest 20% of people in Arizona. So we have a dramatic wealth gap, and you're going to see that it's even bigger for women, and especially single moms. One of the things that leads itself into the wealth gap in the state of Arizona is the rate of imprisonment. And so this is a nationwide rate of people being imprisoned from 1920, when it was less than 100 per 100,000 people, to 2020 or 2019, which is 500 per 1,000 people. So it went up dramatically when we started to see this mandatory sentencing under the Reagan era, and we haven't knocked that back. Even though we know it's discriminatory, we're still doing it. In the state of Arizona in 2019, we had about 10 or so prison reform bills, including attacking mandatory sentencing, and none of them passed. So this is really something we need to do, because it's unnecessarily keeping people in prison. It's hurting them, it's hurting their families, and it's hurting our state budget. It's really not a wise idea. So I'm not going to read all these, but you can see, we've got a lot of statistics that show we're not doing a good job in maternal and child health. Number 46, publicly funded women's health services. 41, children with health insurance. 47, concentrated disadvantage. This is like the people living in that trailer park picture. This is where people who are maybe, if they're lucky, are working multiple part-time jobs. They're barely eking it out because they're only getting $92 a month in TANF or something. But this concentrated disadvantage is something that we really need to look at, and how people are living. Down the bottom, it talks about, you know, we're number 37 in children living in poverty. So we have a long way to go, basically. And here's more: 46 in child well-being, 43 in economic well-being. Again, over and over again, statistic after statistic shows that the Arizona government is not doing a good job when it comes to families, basically. So now we're going to get more into the picture of maternal and child health in the state of Arizona. So one of the things that I didn't really realize, that live births nationwide are going down. And so the state of Arizona was the same as all the other trends. And so what we've seen is that women have fewer babies when they become more educated, when they enter the workforce, when they head households. There's a lot of women heading households by themselves, when they delay childbirth past their 20s, and then when they have access to family planning. So these things are going down across the board. There's been some differences by ethnicity. And you can see so Arizona had a 20% drop in childbirth over that 10-year period, 2007 to 2017. And it went down across the board except for African American moms. They saw an increase in birth. All the others went down. And look at this: Hispanics, 27.4% down over that time period. And there's some good news in that statistic. So overall, though, what we see is disparities across the ethnicities. So, for example, Native American moms are more likely to be under 19 years old. Asian Pacific Islander moms are more likely to be over 30. Hispanic moms are most likely to have less than 9 years of education. So it shows some things that we need to work on, right? And maybe have targeted programs. So this is the education one, and this is what I meant. We have some good data here amongst Hispanics. Look at how much that rate of women with less than 9 years of education went down over that 10 years. You know, I mean, that's a really good public health statistic to look at. All Arizona also went down. That's the next one, the orange one. But it's the Hispanic change that really helped that Arizona rate go down. So this is the teen birth. So teen birth, even nationwide, teen birth is down. It could be better, but it's definitely going in the right direction. So this is one of the good news slides. This is, whoops, hold on a second. This is not, oh, sorry. This is less than 9 years education, sorry. This is the teen birth. Teen birth is going down. Women who are less educated is also going down. So again, those are good things. This one is over 30. So you can see the Asian Pacific Islanders, they are way out of whack with the rest of us. They are far more likely to be over 30 years old. And why is that? Because they're far more likely to be highly educated. And what do those Asian American moms get that the rest of us don't? They are the closest group to being equal with white men in their pay. So this all is like a connect the dots, right? You delay childbirth, you get your education, and you're likely to make more money, and you're likely to have more equity in your pay, right? You have your babies too young, you don't finish high school, or you barely finish high school, you're more likely to live in poverty in the long term, and you'll see that in these slides.